الطيبين الطاهرين. First, I'd like to thank Sister Lima and Sister Letta for inviting me tonight and giving me the opportunity to talk about one of the most important subjects that we really need to address. Considering the time restrictions I was given, very restricted, I'm going to have to really make it as short as possible. For any questions or answers or any questions or concerns, please, I'll be more than happy to take care of it after dinner. The encyclopedia defines addiction as the excessive or addictive use of drugs for non-medical purposes despite social, psychological, physical problems that may arise from the use of these drugs. The Drug Enforcement Agency, however, defines addiction as a compulsive drug-seeking behavior where acquiring and using a drug becomes the most important activity in the user's life. The young Muslims of today are facing an ever-increasing number of dilemmas. One of these dilemmas is drug abuse. What does Islam have to say about this? How should we Muslims regard drug abuse? To understand this, we must dissect this drug abuse issue and educate ourselves about every aspect of it. Over the last decade, drug abuse has been gradually increasing within the Muslim community. In some areas, it's become a crisis, and some are still under the impression that it's not an issue, unfortunately. In the long run, however, a single drug user can have a devastating impact upon the whole community. Unfortunately, these dangerous drugs are perceived by many to be generally safe and effective. As true as that might be, however, there are increasingly, these drugs are being increasingly used or abused to address non-medical conditions or situations. In fact, the practice is occurring among some academic professionals, athletes, performers, older people, and both high school and college students. Such drugs pose the potential high risk involving your own health and addiction, cardiovascular events, psychosis, and very possibly death. From an Islamic perspective, health is viewed as one of the greatest blessings that God has given mankind. Health is indeed a favor that we take for granted. The Quran says, "O believers, this wine, gambling, idols, and these arrows you use for divination are all acts of Satan. Keep away from them so you may succeed." Islam provides a clear direction for every aspect of our lives. Islam also does not shame its believers when they come for treatment. It is our understanding that Allah forgives, and that we as humans have a responsibility to support and assist in recovery whenever possible. It is also the belief of Islam that full adherence to the religious principles of Islam with the support of the Muslim community will provide not only a drug-free lifestyle, but also recovery. The most abused drug among all these drugs that we know of is Adderall. And this is why I want to speak about Adderall specifically tonight. Adderall is also known as amphetamine. Amphetamine or Adderall is used for attention deficit disorder, attention deficit hyperactivity disorder, narcolepsy or sudden sleep, and also obesity. Children as young as 6 years old can be started on Adderall. Most common side effects of Adderall are insomnia, nervousness, loss of appetite, agitation, anxiety, and increased heartbeat. Some street names of Adderall include Speed, Uppers, Black and Blue, Molly's, Coast to Coast, Crisscross, and Footballs. Studies estimate that last year alone, between 2 and 4 million children have been diagnosed with ADD, or attention deficit disorder, or attention deficit hyperactivity disorder, and have been prescribed amphetamines. The only disease that affects more people than drug abuse is heart disease. Drug abuse is the single largest contributor to crime in the USA. Last year alone, the direct cost of drug abuse was estimated at a staggering $52 billion, and an indirect cost of $128 billion. Between the years of 1991 to 2010, retail pharmacies have filled about 17 million prescriptions just for Adderall alone. That translates to about 5,246 prescriptions in a single day. Non-medical use of Adderall among high school seniors have been steadily increasing since 2009. In that year, the abuse rate was at 5.4%. In 2010 and 2011, Adderall abuse increased to 6.5 and continued increasing to 7.6 in 2012. And last year, it went up to even 8%. Now you might ask yourself, why do teens and adults abuse Adderall or drugs in general? They do so for a number of reasons and motives. These include to feel good or get a high, to relax and relieve tension, to reduce appetite and increase alertness, to maintain an addiction and prevent withdrawal, to be accepted by peers, and that's a classic symptom of peer pressure, and also to improve concentration in academic or work performance. Now, sources of Adderall can be getting from their own doctor, they can be getting from borrowing or stealing the drug from family, friends, or co-workers. They can buy the drug from different people who are willing to sell such drugs. And as far as even robbing a pharmacy or somebody's house that has that drug, that's how bad it gets. Early identification of prescription drug abuse and early intervention may prevent the problem from turning into an addiction. Our job as parents is to recognize two main symptoms of such abuse: the physical symptoms and behavioral symptoms. Physical symptoms of drug addiction include weight loss, agitation, insomnia, irregular heartbeat, restlessness, impulsive behavior, and excessive mood swings and hostility. On the other hand, behavioral symptoms include taking higher doses than prescribed, feeling that you have to use the drug regularly, failing to stop using the drug even after many attempts, making sure that you maintain a drug supply, spending money on drugs even though you know you can't afford it, also feeling that you need the drug to deal with your daily problems, poor decision making, appearing to be high, continually losing prescriptions, so now you need more prescriptions from the doctor, and also seeking prescriptions from more than one doctor, which is also commonly called doctor shopping. People of all kinds can become addicted to a drug. However, certain factors can affect the likelihood of developing an addiction. These include family history of addiction, being a male, peer pressure, lack of family involvement, and this is very key, anxiety, depression, and loneliness leading to social exclusion, past or present addiction to other substances including alcohol, younger age, specifically teens and early 20s, exposure to a social environment where there is drug use, easier access to prescription drugs, and their lack of knowledge of prescription drugs. There are several complications associated with Adderall. These include medical and others. Medical complications include Adderall can cause very high body temperature, heart problems, high blood pressure or seizures, tremors, hallucinations, aggressiveness, paranoia, and even death. Other complications include acquiring HIV through sharing needles. You're more prone to suicide. You might have family problems, work issues, problems at school, legal issues, and even financial issues. Unfortunately, there are no drugs currently on the market that are approved by the FDA to treat Adderall withdrawal. Treatment typically focuses on tapering off the medication and relieving withdrawal symptoms. For us to help effectively our kids who are abusing drugs, I've created what's called the rules that parents can follow. The R in rules stands for recognize the symptoms and signs of drug abuse, and that's very key. That's the first step. The U stands for understand what's at the stake and confront with a plan. L stands for listen and communicate effectively. E stands for empathy, not sympathy. That's very key also. S stands for support effectively as a team. And you also need to talk to your children about the risks of drug use and abuse. Be a good listener, set a good example, strengthen the bond between each other. For those who have gone through Adderall withdrawal but are afraid that they might relapse, there are 3 key factors that we can use to prevent that. First, avoid high-risk situations. Second, get help immediately if you use the drug again. And third, stick to your original treatment plan. To conclude, the healthcare provider team, parents, friends, and organizations all can play an important and critical role in identifying and preventing prescription drug abuse. Only we can solve the crisis by working together to put the focus on our youth to prevent drug abuse. Across the nation, healthcare professionals are working hard to educate our loved ones, their parents, and their teachers about the very real dangers of drug abuse in order to achieve our ultimate goal of keeping our neighborhood, our schools, and our families safe and secure. And for those who currently abuse drugs, I have one thing to say. Turn to Allah before you turn to dust. Thank you. Assalamu alaikum.
Thank you, Muhammad, for such a valuable message that inshallah everyone here will pass on to others within the community. Next, I would like to introduce our keynote speaker, Dawood William. He is currently the executive